Let's talk about something nobody wants to bring up at dinner, but nearly everyone over 60 deals with at some point. Hard, difficult bowel movements. Constipation that leaves you exhausted, bloated, and sometimes even in pain. Here's the truth. After age 60, your digestive system slows down. The muscles in your colon lose some of their strength. Medications you take for blood pressure, for pain, for your heart, many of them have constipation as a side effect. Your body produces less digestive enzymes. You might be less active than you used to be. And all of these things conspire together to create one frustrating problem: stools that are hard, dry, and incredibly difficult to pass. But here's the good news. There is one natural approach, backed by research, that works better than most over-the-counter fixes. And there are specific mistakes people make, sometimes for years, that actually train their bowels to become lazier and more sluggish over time. Today, we're going to cover the number one natural fix, the critical mistakes you need to stop making immediately, and a simple daily routine that can restore comfortable, regular bowel movements, without harsh chemicals or expensive supplements. First, let's understand what's actually happening inside your body. Because when you understand the why, the solution makes so much more sense. Your colon, your large intestine, is essentially a long muscular tube. Its job is to absorb water from digested food and push waste toward the exit. It does this through rhythmic contractions called peristalsis. Think of it like a wave squeezing food remnants along inch by inch. After 60, those muscular contractions weaken. The wave becomes sluggish. Food waste sits in the colon longer than it should. And here's the critical part. The longer waste sits there, the more water your colon absorbs from it. What started as soft, manageable material becomes dry, compacted, and hard as clay pellets. Now add medications into the picture. Calcium channel blockers for blood pressure, opioid pain relievers, iron supplements, antihistamines, antacids containing aluminum, antidepressants. Each one of these can slow that muscular wave even further. Some of you might be taking 3 or 4 of these simultaneously, and nobody ever warned you about the cumulative effect on your bowels. Then there's reduced physical activity. When you move your body, walking, bending, stretching, you're also stimulating those intestinal muscles from the outside. When you sit for most of the day, your colon gets the message that there's no urgency. Everything slows to a crawl. And finally, many seniors reduce their food intake as appetite naturally decreases with age. Less food means less bulk moving through the system, less stimulation for those already weakened muscles. So you're dealing with weaker muscles, drying stool, slowing medications, less movement, and less bulk. No wonder things get backed up. Before I reveal the number one natural fix, we absolutely need to talk about what not to do. Because many well-meaning people, maybe even you, are doing things right now that are actively making constipation worse over time. Mistake number 1, relying on stimulant laxatives. This is the big one. Products containing senna, bisacodyl, or castor oil work by forcefully irritating the lining of your colon, triggering emergency contractions. Yes, they produce a bowel movement. But here's what the packaging doesn't tell you in bold letters. When you use these regularly, your colon becomes dependent on that artificial stimulation. The natural nerve signals that trigger peristalsis grow weaker. Your colon essentially forgets how to work on its own. Doctors call this lazy bowel syndrome or colonic inertia. People who've used stimulant laxatives daily for months or years often find that without them, nothing happens at all. They've traded one problem for a worse one. If you're currently using stimulant laxatives every day, don't panic, and don't stop cold turkey without guidance. But recognize that this is not a long-term solution. It's making the underlying problem progressively worse. Mistake number 2, not drinking enough water, then compensating with fiber supplements alone. You've heard it 1,000 times, eat more fiber. So you buy psyllium husk powder or fiber gummies and take them dutifully. But if you're not drinking enough water alongside that fiber, you're creating a cement-like mass in your intestines. Fiber without adequate hydration makes stools bulkier and harder, the opposite of what you want. Many seniors reduce fluid intake because they're worried about frequent urination, especially at night, or because their thirst signals have diminished, which happens naturally with aging, so they're chronically underhydrated without even realizing it. Mistake number 3, ignoring the urge. This one is surprisingly common and surprisingly damaging. You feel the urge to go, but you're in the middle of something, a phone call, a TV program, you're out shopping and don't want to use a public restroom, so you hold it. The urge passes. You figure you'll go later. But here's what happened physiologically. Your rectum stretched to accommodate that stool. Water continued being absorbed. The stool hardened further, and the nerve signals that told your brain it's time grew a little quieter. Do this repeatedly, and those signals become unreliable. Your body stops communicating the urge with the same clarity. Mistake number 4, straining excessively. When you bear down hard, holding your breath, pushing with all your abdominal force, you're raising your blood pressure dramatically. For seniors, this is genuinely dangerous. Straining on the toilet has been linked to hemorrhoids, anal fissures, rectal prolapse, and in extreme cases, cardiac events. Some people have triggered strokes from excessive straining. Beyond the immediate dangers, straining doesn't actually help much. It creates pressure but doesn't address the fundamental problem: dry, hard stool that won't move. Mistake number 5, sitting on the toilet too long. Spending 20 or 30 minutes on the toilet, scrolling through your phone or reading, puts sustained pressure on the veins around your rectum. This is one of the primary causes of hemorrhoids. If nothing is happening within 5 to 7 minutes, it's better to stand up, walk around, and try again later. All right, you've been patient. Let's talk about the single most effective natural approach to softer, easier bowel movements, and it's probably simpler than you expect. The number 1 natural fix is magnesium-rich water combined with a specific morning hydration routine. Let me explain exactly how this works and why it's so effective. Magnesium is an essential mineral that does something remarkable in your intestines. It draws water into the colon through a process called osmosis. When magnesium reaches your large intestine, it pulls fluid from surrounding tissues into the intestinal space. This fluid softens and loosens stool naturally. No harsh stimulation, no dependency, no cramping. Unlike stimulant laxatives, magnesium doesn't irritate or weaken your colon's muscles. It simply ensures that stool remains hydrated and soft enough to pass without straining. Here's the specific routine that works for most people. The morning hydration protocol. When you wake up, before coffee, before breakfast, before anything else, drink 16 ounces of warm water. Not hot, not cold. Warm like a comfortable bath temperature. Add to this water either a quarter teaspoon of magnesium citrate powder or simply squeeze half a lemon into it. Why warm? Warm water stimulates peristalsis. It gently wakes up those intestinal muscles the way a warm shower loosens stiff joints. Cold water can actually cause the smooth muscles to contract and tighten. Why first thing in the morning? Because your colon has a natural reflex called the gastrocolic reflex. When your stomach fills after a period of being empty, like overnight, it sends a signal to the colon saying, "Make room, new material is coming." This reflex is strongest in the morning. By drinking warm water on an empty stomach, you're triggering this reflex at its peak effectiveness. The magnesium ensures that whatever is sitting in your colon from the previous day has been softened overnight and is ready to move when that reflex fires. Now, beyond this morning ritual, let me give you the complete daily approach. Throughout the day, aim for magnesium-rich foods. Dark leafy greens, spinach, Swiss chard, kale, pumpkin seeds and almonds, avocados, black beans, dark chocolate, yes, really, bananas. These foods provide a steady supply of magnesium that keeps your intestinal fluid levels balanced. Hydration targets. Most seniors need 6 to 8 glasses of water daily, not coffee. Coffee is actually a mild diuretic that pulls water away from your colon, not juice loaded with sugar. Plain water, herbal tea, or water with a splash of lemon. Spread it throughout the day rather than gulping large amounts at once. If you're over 60 or caring for an elderly loved one, this information could genuinely change daily quality of life. Comfortable bowel movements aren't a luxury. They affect your mood, your energy, your appetite, and even your sleep. Please share this with someone who might be suffering in silence. The positioning change that makes an enormous difference. Here's something most Western doctors never mention. The standard toilet puts your body at a 90-degree angle, thighs level with the floor. But this angle actually kinks a muscle called the puborectalis, which wraps around your rectum like a sling. At 90 degrees, that sling is partially tightened, creating a bend that makes elimination harder. The solution is laughably simple. Place a small footstool, 6 to 8 inches high, in front of your toilet. Rest your feet on it so your knees rise above your hips. This position straightens the anorectal angle, releases the puborectalis muscle, and allows gravity to assist elimination. Studies published in the Journal of Clinical Gastroenterology found that this squatting-like position reduced straining time and improved the sensation of complete evacuation in the majority of participants. Some people report results the very first time they try it. The timing habit. Your body responds powerfully to routine. Try to sit on the toilet at the same time every day, ideally 15 to 30 minutes after your warm morning water and breakfast. Even if you don't feel an urgent need, you're training the gastrocolic reflex to fire predictably. Within 1 to 2 weeks, most people find their body begins anticipating this schedule. Don't strain during this time. Sit in the elevated knee position, breathe slowly and deeply into your belly, and allow your pelvic floor to relax. Gentle rocking side to side can also stimulate movement. Give it 5 minutes. If nothing happens, stand up and try again after your next meal. Let me give you several more tools to keep in your arsenal. Movement. Even 10 minutes of walking after meals significantly stimulates intestinal motility. You don't need to run a marathon. A gentle walk around the block, some standing stretches, even seated twisting movements in a chair. All of these compress and release the abdominal area, massaging your intestines externally. Abdominal self-massage. This is an old technique that gastroenterologists sometimes recommend for stubborn cases. Lie on your back with knees bent. Using moderate pressure with your fingertips, massage in a clockwise direction, starting at your lower right abdomen, moving up, across, and down the left side. This follows the path of your colon. Spend 5 minutes doing this before your morning toilet sit. Some people feel gurgling and movement within minutes. Prunes, nature's gentle laxative. Prunes contain sorbitol, a natural sugar alcohol that draws water into the intestines similarly to magnesium. They also contain fiber and specific compounds that mildly stimulate peristalsis, but gently, without the dependency risk of senna-based laxatives. 3 to 5 prunes daily or a small glass of warm prune juice in the morning can provide noticeable improvement within 48 hours. Healthy fats. Olive oil, avocado, fatty fish, nuts. Dietary fats lubricate the intestinal lining and help stool slide through more easily. A tablespoon of extra virgin olive oil on an empty stomach in the morning is a Mediterranean folk remedy that actually has physiological merit. The fat stimulates bile release, which itself promotes peristalsis. Probiotics. Your gut bacteria play a significant role in motility and stool consistency. Fermented foods, plain yogurt, kefir, sauerkraut, kimchi, introduce beneficial bacteria that can improve transit time. Look for yogurt containing bifidobacterium strains specifically, as research links these to improve stool frequency in elderly populations. Now, I want to be clear about something important. While occasional constipation is common and usually manageable with these natural approaches, certain symptoms require medical attention. Please don't ignore these. Blood in your stool, whether bright red on the tissue or dark and tarry in the bowl. This needs investigation. A sudden dramatic change in bowel habits that lasts more than 2 weeks, especially if you're over 50 and haven't had a recent colonoscopy. Severe abdominal pain accompanying constipation, particularly if your abdomen feels rigid or distended. Unintentional weight loss combined with changes in bowel habits. Pencil-thin stools consistently. This can indicate a narrowing somewhere in the colon that needs evaluation. The inability to pass gas along with inability to have a bowel movement. This combination can signal a bowel obstruction, which is a medical emergency. These natural strategies are for garden variety sluggish bowels, the kind caused by aging, diet, hydration, and lifestyle factors. They are not a substitute for proper medical evaluation when warning signs appear. Let me pull everything together into a simple morning routine you can start tomorrow. Wake up. Drink 16 ounces of warm water with magnesium citrate powder or fresh lemon juice. Wait 10 to 15 minutes. Eat breakfast. Include some healthy fat and fiber. Oatmeal with ground flaxseed and a drizzle of olive oil, or whole grain toast with avocado. A handful of prunes alongside your meal. 15 to 30 minutes after eating, sit on the toilet with your feet elevated on a stool. Lean slightly forward. Breathe deeply into your belly. Relax your jaw. When your jaw relaxes, your pelvic floor tends to release as well. Give yourself 5 quiet minutes. Throughout the day, drink water regularly. Move your body. Walk, stretch, garden. Eat magnesium-rich foods. Listen to your body's urges and respond promptly. That's it. No expensive supplements, no harsh chemicals, no dependency. Just working with your body's natural mechanisms instead of against them. Many seniors suffer with this problem silently for years, thinking it's just an inevitable part of aging. Thinking there's nothing to be done except take stronger and stronger laxatives. That simply isn't true. Your body still knows how to do this. It just needs the right conditions. Adequate hydration, the right minerals, proper positioning, consistent timing, and gentle movement. Give it those conditions, and most people see meaningful improvement within 1 to 2 weeks. You deserve comfortable mornings. You deserve to feel light and energized instead of bloated and backed up. You deserve the dignity of easy, painless elimination. And now you have the tools. If this information helped you, please subscribe to this channel. We share practical health guidance for adults over 60 every single week. Hit that notification bell so you never miss a new video. Share this with a friend, a spouse, a parent, or a sibling who might be dealing with this privately. Sometimes the most loving thing you can do is send someone information they'd never search for themselves. And drop a comment below. Tell me, which of these tips are you going to try first? I read every single comment, and I'd love to hear from you. Take care of yourself. You're worth it.